This segment of Showcase is brought to you by the Aesthetic Center of Richmond Dermatology. We're here with Ashley today, and we are doing Brotox.
Yes.
All right, so explain to us, is there a difference between Brotox and regular Botox?
Somewhat, yes. So with a male muscles tend to be a little bit stronger than a female anatomy. Another thing is that men tend to not want a more feminized approach to their face, right? So with a woman, we're trying to give them a little bit of a lateral brow lift. With a man, we don't want to do that. We want to keep his brows nice and straight, everything to look masculine, nothing too frozen, nothing too overdone.
I think it's funny that you mentioned that because I have seen, especially on some of the influencers online, where some of the males do have the eyebrows that kind of arc up. Yeah, it looks a little strange. So what you're saying is that the placement of where you put that, why the provider is so important, is to make sure that that's not necessarily the look, if that's not their intended look.
Yes, absolutely.
All right, so how do we get started? Have you done this before?
I have.
You've done this before, okay.
He's no stranger.
All right, perfect.
Yes. So we're gonna clean him off with a little bit of alcohol first, and then I will mark him up with a marking pen.
Ashley, how many guys do y'all typically see here at Accord?
I would say we have about 20 to 30% male patients.
So it's more common than I think most people think.
Yes, it's definitely becoming more popular. I think that there were so many misconceptions back in the day that men can't get Botox done because it's gonna make them look feminine, or it's gonna look like they had a lot of work done, or be super frozen or something like that. But it's just so not the case. It's making them look more refreshed. A lot of them come to me because they feel like they're looking tired or angry, or they're still in the workforce and they just want to feel more refreshed. So yeah, it's becoming more common than what you would think. So Scott, I'm gonna have you do like a little angry face or scrunch for me. You can see Scott pulls pretty hard here. So we're gonna make little dots where we're gonna treat.
And so those markings are where you're gonna go in with the needles. Okay.
And then raise up your eyebrows as high as you can. Great. Now with Scott, I'm not afraid to go a little bit lower on his forehead than I would with a female, because again, I am not trying to give him a lateral brow lift. I'm trying to keep everything nice and straight. And then do your cheesy smile for me. Another way to achieve a lateral brow lift is going at the tail of the brow. So I'm not gonna do that for Scott. I'm gonna go down a little bit lower. A lot of males like to have a little bit of natural movement around their eyes too. They don't wanna look too done. Perfect.
And do you feel like each face is different and kind of the request of what that person really wants?
Absolutely, yeah. It's very tailored and customized to what the patient is specifically looking for. I mean, it's not like I've never had a male say, freeze me up. And then I've had other people that are like, I want to look like I had nothing done.
Right, that I just went on a long vacation and feel fabulous.
Exactly, and that's mainly the goal anyway.
And for people who have not had Botox or anything like that done before, what's usually the recovery time?
Oh, it's really easy peasy. When you first leave here, you're gonna have tiny little bug bite looking marks. I don't want you to rub those. I don't want you to lie flat back for the next 4 hours. No exercise for 24 hours. No makeup on the site for 24 hours. But other than that, I mean, it's pretty in, pretty out, easy.
Excellent.
Yeah. Scott, do you want like a little vibrating distractor tool to hold on to?
I'm good.
You're good? Okay.
No judgment if you wanted it. We're not judging.
I love it, so.
And how often would someone come in to get refreshed?
Typically 3 to 4 months is the time frame that we go with. All right, Scott, I'm gonna start in between your eyebrows first. All right, I'm just gonna lift this guy up. Okay, and then go ahead and lay your head all the way back for me. You're gonna feel tiny little pinches. And this can just feel like little mosquito bites.
Easy. So Ashley will keep doing that as Scott finishes up his treatment here, but it is super easy. And if you're not really sure if it's right for you or what you would look like, you can always call here to the Aesthetic Center of Richmond Dermatology. They'll talk you through the whole process for your Brotox appointment. And this segment of Showcase is brought to you by the Aesthetic Center of Richmond Dermatology.